Alright, so this is the sheep heart dissection. First up is the superior vena cava, which is towards the back of the heart, right over the right atrium. Next is the bicuspid valve, which is in the left, in the middle of the left atrium and left ventricle. And it's a little flap connected with a bunch of stringy things called the chordae tendineae. Next up is the left auricle, which remember is the left side in terms of the patient's perspective, not your perspective, or in this case, I guess the sheep's. But it's on the left side. It's like brown on the very top, and then comes the coronary sinus, which is a hole on the right atrium, and then after that is the right ventricle, which is the bottom half of the right side. And then after that is the inferior vena cava, which is sort of down the path of the superior vena cava. You can't see it as well on this heart since it's cut up, but it should be to the left of the superior vena cava. After that comes the right auricle, which is on the left in your perspective, and it's the brown thing on the top. After that is the pulmonary trunk, which is right there. Then comes the tricuspid valve, which is in the middle of the right and left, or the right atrium and ventricle, and it's a flap. It's a flap connected with the chordae tendineae. Then the stringy things on the tricuspid valve are called the chordae tendineae. And the next is the opening of the coronary arteries, which is on the left atrium, and it's the hole right there. Then comes a pulmonary semilunar valve, which is that flap right there. Then comes the left ventricle, which is the bottom side of the left side. Then comes the aortic semilunar valve, which is that flap right there. Then comes the fossa ovalis, which is like a little belly button right there. Then comes the papillary muscle, which is right there. And then the aortic arc. And that's pretty much it.